Have you ever experienced a health change that seemed too small to worry about? Maybe your stomach feels unusually bloated, you get full after eating only a small amount of food, or you suddenly need to use the bathroom more often. Most people would not immediately think of cancer when they notice these things. They might blame stress, digestion, aging, or a change in routine. And in many cases, those explanations are correct. But ovarian cancer presents a unique challenge because its early warning signs are often subtle and can look like everyday problems. The danger is not that the symptoms are always severe. The challenge is that they can be easy to ignore. Today we are going to look at 9 warning symptoms of ovarian cancer, why they happen, how doctors interpret them, and when these changes deserve medical attention. This information is not meant to create fear. It is meant to help you understand your body better and recognize when a pattern may need to be evaluated. Ovarian cancer develops in the ovaries, the reproductive organs that produce eggs and hormones. One reason it can be difficult to detect early is because the ovaries are located deep inside the pelvis. Early changes may not create obvious symptoms until they affect nearby structures, including the bowel, bladder, or abdominal area. Medical experts, including organizations such as the National Cancer Institute and the American Cancer Society, recognize that ovarian cancer symptoms are often nonspecific. This means the symptoms can also occur with many other conditions, such as digestive disorders, urinary problems, hormonal changes, or benign ovarian conditions. So the important question is not, do I have one of these symptoms? The more useful question is this a new change that is persistent, unusual for me, and happening without a clear explanation? Let's examine the symptoms one by one. The first warning symptom is persistent bloating or an increase in abdominal size. Many people experience bloating occasionally. It can happen after certain foods, constipation, hormonal changes, or digestive issues. Occasional bloating is usually not a reason to assume something serious. The concern is when bloating becomes a pattern. For example, someone may notice that their abdomen feels swollen almost every day for several weeks, their clothes fit differently, or they feel constant pressure in the stomach area. Why can ovarian cancer cause this? As a tumor grows, it can affect the space inside the abdomen. In some cases, fluid can accumulate in the abdominal cavity, creating swelling and discomfort. Research shows a relatively strong association between persistent bloating and ovarian cancer symptoms, but bloating alone is not enough to diagnose the disease. Many non-cancer conditions cause the same symptom. The key is the combination of timing, persistence, and other changes happening at the same time. The second warning symptom is feeling full quickly or losing your usual appetite. Imagine someone who normally finishes a full meal but suddenly feels uncomfortable after eating only a small portion. They may not feel hungry because their abdomen feels full before they have eaten much. This can happen because changes in the pelvic area may affect nearby digestive organs and create pressure or a sensation of fullness. Again, this symptom has many possible explanations. Acid reflux, stomach problems, stress, and other digestive conditions can also cause early fullness. However, when this is a new and ongoing problem, especially along with bloating or abdominal discomfort, it becomes more important to discuss with a healthcare professional. The third warning symptom is pelvic or abdominal pain. Pain is one of the body's most noticeable signals, but it can be difficult to interpret because many conditions cause discomfort in this area. Ovarian cancer may cause pain, pressure, cramping, or a feeling of heaviness in the lower abdomen or pelvis. But pelvic pain can also come from common causes such as menstrual changes, ovarian cysts, endometriosis, urinary problems, or digestive disorders. A common misconception is that serious diseases always cause intense pain. That is not true. Some medical conditions produce mild or vague symptoms, especially in earlier stages. The important factor is whether the pain is new, persistent, different from your usual experience, or associated with other symptoms. The fourth warning symptom is frequent urination or increased urinary urgency. Many people associate frequent urination only with bladder infections or drinking more fluids. However, the organs inside the pelvis are located close together. If an ovarian tumor grows, it may place pressure on the bladder. This can create the feeling that you need to urinate more often or urgently. A temporary change, such as needing the bathroom more after drinking extra fluids, is usually not concerning. But if urinary changes continue without an obvious reason, especially with abdominal or pelvic symptoms, they should not be ignored. The fifth warning symptom is a change in bowel habits. Some people with ovarian cancer experience constipation, diarrhea, or a feeling that their digestion has changed. The reason is related to anatomy. The ovaries are located near parts of the intestine, so changes in the pelvic region can sometimes influence bowel function. However, this symptom requires careful interpretation. Digestive problems are extremely common. Most people with constipation or occasional bowel changes do not have ovarian cancer. The concern increases when bowel changes are new, persistent, and occur together with other warning signs. The sixth warning symptom is unexplained fatigue. Fatigue is one of the most common symptoms people experience, and it has many possible causes. A busy lifestyle, poor sleep, stress, anemia, thyroid problems, infections, and medications can all contribute to feeling tired. Cancer-related fatigue can happen because the body uses energy differently when responding to abnormal cell growth. However, fatigue alone is considered a less specific warning sign. The important question is whether the tiredness feels different from normal. Is it lasting for weeks? Is it affecting daily activities? Is it happening along with other symptoms? The seventh warning symptom is unusual vaginal bleeding or menstrual changes. Changes in bleeding patterns should always be taken seriously, especially bleeding after menopause. Although abnormal bleeding is not the most common symptom of ovarian cancer, it can sometimes occur because certain ovarian tumors influence hormone levels. There are many other possible causes of abnormal bleeding, but unexplained bleeding deserves evaluation. The eighth warning symptom is back pain. Back pain is extremely common and most cases are not related to ovarian cancer. However, some people with ovarian cancer report lower back discomfort because of pressure or irritation in the pelvic area. The important point is that back pain by itself is not a strong indicator. But when new back pain appears together with symptoms such as persistent bloating, pelvic discomfort, urinary changes, or appetite changes, doctors pay more attention to the overall pattern. The ninth warning symptom is unexplained weight changes. Unexpected weight loss can occur with many serious health conditions, including cancer. With ovarian cancer, weight changes may happen because of reduced appetite, digestive symptoms, or changes in how the body uses energy. But weight loss should always be interpreted carefully. A person losing weight because they intentionally changed their diet is very different from someone losing weight without trying. Unexplained weight loss combined with other symptoms should be discussed with a healthcare professional. One of the biggest reasons ovarian cancer symptoms are missed is because people look for one dramatic warning sign, but medicine often works differently. Health problems are frequently identified through patterns rather than one isolated clue. Think of symptoms like pieces of information. One piece may not tell you much, but several pieces together can create a clearer picture. Doctors consider factors such as how long the symptoms have lasted, whether they are getting worse, whether they are unusual for that individual, the person's age, family history, and other medical risk factors. Some people have a higher risk of ovarian cancer, including those with certain inherited genetic changes, such as BRCA1 or BRCA2 mutations, or a strong family history of ovarian, breast, pancreatic, or related cancers. However, ovarian cancer can also occur in people without obvious risk factors. That is why awareness of symptoms remains important. So what should you actually do if you notice these changes? First, avoid panic. Many of these symptoms are caused by conditions that are not cancer. Second, pay attention to patterns. A single episode of bloating after a large meal is very different from daily bloating that continues for weeks. Third, consider keeping a simple record of symptoms. Write down when they started, how often they happen, whether they are getting worse, and any other changes you notice. This information can help your healthcare provider understand what is happening.
Another important point is that ovarian cancer does not currently have a general screening test recommended for average-risk women that has been proven to reduce deaths from the disease. Tests such as ultrasound and the CA-125 blood test may be useful in certain situations, but they are not recommended as routine screening tools for everyone because they can sometimes produce false alarms or miss disease. The right approach depends on individual risk and medical history. You should consider speaking with a healthcare professional if you experience symptoms that are new, persistent, frequent, worsening, or occurring together. People with a strong family history of ovarian or related cancers, known genetic risk factors, or previous cancer diagnoses should discuss their personal risk with a medical professional. Remember, having these symptoms does not mean you have ovarian cancer. The goal is not fear. The goal is awareness and appropriate action. Let's quickly review the 9 warning symptoms. Persistent bloating, feeling full quickly, pelvic or abdominal pain, frequent urination, changes in bowel habits, unexplained fatigue, abnormal bleeding or menstrual changes, back pain, and unexplained weight changes. The most important lesson is this: ovarian cancer symptoms are often subtle, but patterns matter. A symptom that is new, persistent, and unusual for your body deserves attention. Your practical takeaway is simple. If you notice a combination of these changes lasting for several weeks, write them down and discuss them with a healthcare professional instead of waiting for them to disappear on their own. This video is for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Symptoms discussed here can have many different causes, and having one or more of these symptoms does not mean you have ovarian cancer. If you have concerns about your health or ongoing symptoms, consult a qualified healthcare professional for personalized guidance.